improving people's well-being by being better at doing some preventative and some disease management capabilities, while at the same time reducing the cost and the footprint overall in the healthcare system.
Don?
I agree, but I'll give you a couple examples. There are a number of companies manufacturing what are going to be called, what we call smart Band-Aids or wireless Band-Aids, so peel and stick disposables, much like this, to measure all the vital signs. And in the hospital, we're going to see a lot of deployments of these smart Band-Aids for acquiring your vital signs. And so it's going to be, in the not very distant future, you'll check into the hospital, the nurse will just have you open your shirt or blouse and you'll put some Band-Aids on, and that's how your blood pressure and heart rate and respiratory rate will be acquired. These are systems that are well in advanced states of clinical trials and in some cases are already commercial. But the disruption is the fact that the nurses think they're being put out of work. Now, if you think about it, a nurse is a highly trained professional. She's doing 200-year-old technologies, looking at your chest, watching it rise and fall to see what your respiratory rate is, putting your fingers on your wrist to acquire your pulse, pumping up, spending minutes there pumping up the blood pressure cuff. That's pretty mundane labor. If we can get rid of that, then presumably we can take these highly educated people and put them into more clinically appropriate. But the disruption part comes in the early adoption phase, where it looks like maybe I'm not needed anymore because these things are being automated, when in fact I think what's really going to happen is their time is going to be redirected into much higher quality kinds of intervention. So that's the kind of disruption that I see, except on my example on the supply side, where we'll see maybe some disruption in distribution channels. If I can literally open a pill bottle cap when I've shaken out the last pills and say I need some more by pushing the button on the bottom of the pill bottle here, very convenient for me as a consumer, very disruptive for the retail pharmacy if I'm now getting it directly from mail order via FedEx.
Thanks, Don. I think we're getting run off the stage, but maybe just a quick sentence or two from both Mike and Ken as the last word.
I'm disruptive.
Yeah.
Okay, well then very quickly, I mean, I obviously work for a technology working to enable these, and I think that fundamentally how these jobs are done is going to be disruptive, but the point, you know, the nurse, the doctor, the consumer, they don't care if it's Bluetooth, they don't care what the technology is, they want it easy, simple, and to work. And so, you know, that's what we're working on to deliver, and if us as an industry can do that, I really do think it will be disruptive.
And I actually got pretty upset with an editor like Brian that came out and said we had the best disruptive technology coming on the marketplace for the future, and I'm like, what do you mean we're disruptive? You know, but it's a positive thing. You know, actually, he didn't say that. Somebody else said it. But absolutely, I do believe it's disruptive technology. It gets to the same, you know, the same point where we need to get it in healthcare, but in a different way.
Great. Well, hopefully we can continue some of these conversations in the hallway or during the lunch break in the next hour or so.
Wasn't this a great panel, everybody?